Dumelang, Sanbonani, Molweni, and good day, ladies and gentlemen. My name is Dr. Tendai Garuta from the School of Social Sciences within the Faculty of Humanities. I would like to thank the university management for giving us this platform to commemorate Father's Day and to showcase the research which is being done on men's health and well-being. Nelson Mandela once said, "We can change the world and make it into a better place, and it is within our hands to make that difference." Today we have three speakers who are going to present their papers for 25 minutes each. Welcome Prof. Ruwen Kruger, Prof. Martin Palamuleni, and Prof. Salome Kruger. Our first speaker is Prof. Ruwen Kruger from the Faculty of Health Sciences. He is a South African research chair in the early detection and prevention of cardiovascular disease in Africa. His topic is also titled Tackling High Blood Pressure for Optimal Cardiovascular Health. Prof, the floor is yours.
Dear students, colleagues, alumni, and friends, it is my pleasure to present to you some important information on how to tackle high blood pressure for optimal cardiovascular health, especially in the setting of Men's Health Month. I have no conflicts of interest or financial disclosures to report. The contents of this presentation will cover the following points: know your numbers, why is high blood pressure dangerous, how to prevent high blood pressure, what if you already have hypertension, and some complications in hypertension. Now, I'm hoping that everyone watching this presentation has had some experience in having your blood pressure checked, at least in the past year. In this slide, I have an image here of an electronic blood pressure device showing three sets of numbers. The first 124 millimeters of mercury indicates the systolic blood pressure, which is the highest pressure in the arteries when the heart contracts and pushes the blood to the rest of the body. The next value, 76 millimeters of mercury, is the diastolic blood pressure, which indicates the mean blood pressure in the arteries between every heartbeat and when the heart relaxes. The last number, 74 beats per minute, indicates the heart rate or the number of heartbeats in 1 minute. Now, ideally, we want our blood pressure to be 120 over 80 millimeters of mercury. And when it is slightly higher, between 120 to 139 millimeters of mercury systolic blood pressure, or diastolic blood pressure between 80 and 89 millimeters of mercury, we call this elevated blood pressure, and the recommendation is to keep an eye on this and adjust your lifestyle choices to live a bit more healthy, stress less, and be more physically active. But if your resting blood pressure is higher than 140 systolic blood pressure, or greater or equal than 90 diastolic blood pressure, then this may be a concern. And this can be either of the two that are higher. Both of these values indicate some kind of cardiovascular risk and has to be checked by your healthcare professional to confirm whether this is indeed high blood pressure. So when we go to the doctor, they have to take your blood pressure. Some doctors may have you lie down on the bed or be in a semi-recumbent position, and that is not always correct to accurately measure blood pressure. So as indicated in this picture, the patient has to sit upright with their back supported, the feet on the ground, and in a relaxed position before the blood pressure is measured. In the subsequent figure, this is illustrated by the International Society of Hypertension's latest guidelines, where the appropriately sized cuff should be used on the upper arm. The patient has to be in a relaxed setting. And on the next slide are a few recommendations of the optimal conditions for measuring blood pressure at the doctor's office. Of note here is that the room should be quiet. There should be no talking or noise or interference when the measurement is done. The patient should also, prior to the measurement, not smoke, use caffeine products, or exercise, should have an empty bladder, and also be rested for at least 5 minutes. The protocol is that the doctor should at least measure 3 blood pressure measurements in order to confirm if you do have high blood pressure. If your first blood pressure reading is below 130 over 85 millimeters of mercury, then subsequent measurements are not necessary. Our group in the Hypertension in Africa research team at the Northwest University are annually involved in a global screening campaign for high blood pressure. And we collaborate with the World Hypertension League on World Hypertension Day, which is typically the 17th of May, but this year, due to the global pandemic, it has moved to October the 17th. And here you can see some of our team members and postgraduate students who were involved in the May Measurement Month, which is this large global screening campaign for high blood pressure, which is an awareness campaign to make people aware of the importance of high blood pressure and the dangers if it goes unnoticed. So globally, non-communicable disease, which includes cardiovascular diseases and hypertension, accounts for the majority of people living with non-communicable disease, as indicated in this graph, with the darker blue shade indicating cardiovascular diseases that are the greatest of the non-communicable diseases worldwide. In South Africa, we have the same prevalence of cardiovascular disease. As you can see, that it exceeds the disability-adjusted life years of all the other listed conditions. Just after the year 2010, cardiovascular disease or non-communicable diseases exceeded that of HIV and TB, which were, of course, the number one causes of death in South Africa. In this slide, I would like to just highlight the fact that for both men and women, there are equal risks in cardiovascular disease and other diseases. However, if you just look closer to this lighter blue shade indicating cardiovascular diseases, you will see at younger ages, men are more prone to develop these cardiovascular diseases earlier compared to women. So why is high blood pressure dangerous? Well, the first reason is because high blood pressure affects many organs in the body. So it has effects on various parts of the body, as well as it is a silent condition, which indicates that damage is being done without you noticing symptoms and signs that could alert you for this condition. Just quickly highlighting that if you have hypertension, the heart is affected where it can develop valve abnormalities. You could have a heart attack because of high blood pressure and develop subsequent heart failure. The brain is also susceptible for higher pressures and intracranial pressure, especially when it comes to hemorrhagic strokes. Also small vessel diseases, and in older age where dementia can be observed in patients with severe hypertension. The eyes are also a target organ where vision loss has been reported, and also increased pressure in the form of glaucoma in the eyes, and also blood vessel strain due to hypertension. The kidneys are believed to be primary to the onset of hypertension, very important organs to regulate blood pressure. And in the setting of blood pressure, there will be signs of acute kidney injury, also the development of chronic kidney disease, and then subsequent renal failure. The lungs are also involved in certain hypertensive conditions, such as pulmonary hypertension, where the right heart is normally affected, where there's peripheral fluid buildup in the body, and also jugular vein distension. Other organs such as the liver, the spleen, and the pancreas are also involved in hypertensive conditions. And some of those conditions also include diabetes, where there are endocrine abnormalities. And because of the effect of hypertension on these organs, there can be thrombotic complications, portal hypertension that can be seen in the liver, splenomegaly, liver cirrhosis, and also fatty liver disease, which can be also a consequence of alcohol abuse. Recent evidence also suggested that the colonies of bacteria living in our guts can contribute to hypertension and cardiovascular diseases due to its effect on immune responses that are being altered, and also because of its interactions with the renin-angiotensin system, which is closely related to the function of the kidneys. So how do we tackle the onset of high blood pressure? The only way to tackle the onset of high blood pressure is by following a healthy lifestyle and avoid excessive sugar and salt intake. Also to avoid sedentary behavior by sitting on the couch, and also overuse alcohol, cigarette smoking, and unhealthy habits. All these unhealthy habits contribute to the development of obesity and subsequent diabetes, both of which accompanies high blood pressure. But Prof. Salome Creer will also give more detail on healthy eating in one of the next presentations. There are also other factors that may raise your blood pressure, which many people do not know about. For example, caffeine intake acutely raises blood pressure, and so do caffeine-containing energy drinks such as Monster, Play, and Red Bull, to name a few. Aside from the benefits reported by studies on coffee consumption, such as its anti-inflammatory and antioxidant functions, and the beneficial effects of slowing some disease states such as Alzheimer's disease. But if you do have hypertension, caffeine intake should rather be avoided, as it can also contribute to increases in blood sugar levels. Also, over-the-counter medication can contribute to increases in blood pressure, such as opioids and non-steroidal anti-inflammatory drugs, and others, as well as some prescription drugs that might increase the blood pressure. Therefore, it's important to read the leaflet insert of the medication to understand side effects of blood pressure. In our daily lives, we also make use of herbs, spices, and home remedies for certain ailments, while some of what we may use can increase blood pressure. Some of these are definitely salt, licorice intake, and also strong cheeses and soy products. But there can also be interactions between some of these herbs and foods that we use, as well as prescription drugs and other supplements. And these supplements can include energy drinks, anabolic, protein shakes, and other non-essential supplementation. However, it has been shown that beetroot and dark leafy green vegetables are contributing to effectively lower the blood pressure. So what if you already have hypertension? I would like to share some pointers to keep in mind if you do have high blood pressure. The first thing is to adhere to the prescription and instructions provided by your healthcare professional. Be compliant in their advice, as they do understand the mechanistic function of the medication you are taking. Never stop taking your blood pressure medication. So if you've started using blood pressure medication, don't decide by yourself to stop. Rather, talk to your doctor about this if you have any side effects or problems when you are using this medication. But do not just stop taking the medication, as it can cause potential development of uncontrolled or even resistant hypertension. And also, if you forget to take your blood pressure medication, do not take a double dose the next time to compensate for that. In this graph, I just want to draw your attention to the prevalence of hypertension in low to middle income countries compared to high income countries. So the prevalence is slightly higher in the lower to middle income countries compared to the high income countries due to the possible differences in healthcare systems and the availability of resources. However, the awareness of high blood pressure is much, much lower in low to middle income countries compared to high income countries. And the treatment of hypertension is also not ideal in low to middle income countries. What is more worrying is the controlled hypertensives, which is only 7.7% in low to middle income countries compared to 28% in high income countries, which is also quite unacceptable. So that means we have to be aware of high blood pressure and take the treatment and ensure that we stay informed and adhere to the prescriptions. Studies have also indicated the consequences of not taking blood pressure treatment regularly and as advised, which can lead to several complications as listed in this table. The next pointer is to regularly measure your blood pressure. Be sure to take your measurements in a quiet space without too many distractions. Also, make sure you make use of validated blood pressure devices. And in this link provided in the slide, you can go to that website and there will be a comprehensive list of all the blood pressure devices that have been validated. Non-validated blood pressure devices may give you lower or higher estimations of your blood pressure, which is inaccurate and then can lead to false assumptions, especially when prescriptions or diagnosis is to be made. Also, make sure to have your blood pressure device calibrated regularly. You can also contact your manufacturer for this information and also go to the link supplied below. Always seek professional advice on your blood pressure values if you are indeed concerned about the numbers. In this table, I just want to indicate that if you do perform home blood pressure measurements, this last line in the table, then you should make sure that the blood pressure value is less than 135 systolic blood pressure over less than 85 millimeters per mercury. Then you should be in the normal range for home blood pressure monitoring. Then always talk to your doctor and make sure that they talk to you. So communication in this setting is very important because thorough information will give the healthcare professional enough information to make the right prescription and diagnosis. If you're uncomfortable with the diagnosis, you have to mention it and have a discussion with your healthcare professional and even seek a second opinion if necessary. If you experience any side effects due to the antihypertensive treatment, you also have to report that as soon as possible to make amendments to your treatment plan as soon as possible. In this graph, the green block indicates that you are healthy and that you have normal blood pressure. In the blue block, indicating white coat hypertension means that your blood pressure is higher in the office, meaning at the doctor's office, but your blood pressure is normal when you are at home. This does not mean that it's benign, but that your blood pressure has to be monitored closely. Masked hypertension in the yellow or the orange block indicates that you have high blood pressure at home, but your blood pressure at the doctor's office is normal. But this poses a risk, as in your daily activities you have high blood pressure, so that does include increased risk. And the red block is sustained hypertension when both your blood pressure is high at the doctor's office and at home. You should also understand the treatment that is provided by your healthcare professional and whether these treatment options are working for you in the sense of side effects. So you have to keep track of your side effects, which could include coughing, diarrhea, dizziness, feeling nervous, feeling tired, having headaches, and so on. and you have to report these side effects to your healthcare professional. And also make sure that you take your medication and don't lie that you are taking the medication, but instead you are not. There are certain medications that could be adverse, especially for men, where erectile dysfunction has been reported, and drugs that cause the most erectile dysfunction problems include diuretics, which are water pills, and beta blockers, whereas the ACE inhibitors and the calcium channel blockers are less likely to cause erectile dysfunction. So if you experience such problems, it is also important to communicate that to your healthcare professional, as this can be treated as well. So are there any complications in the setting of high blood pressure? Well, in general, there are always individuals with a genetic predisposition to develop hypertension at an earlier age compared to their age-matched peers. These differences can even be seen from as early as infancy and childhood. But this is no advance in the medical field, and much more research is needed in this particular focus of early vascular aging. But ideally, we want to be on the green line as indicated on this figure. But unfortunately, many of us follow the trajectory on the blue line due to possible unhealthy lifestyle, or because we inherited the not so kind gene pool from our parents and grandparents. Others are less fortunate due to complications in early development prior to birth, and are susceptible to have an accelerated biological aging as indicated with the red line. Now, certain disease conditions are also accompanied by changes in blood pressure, including type 2 diabetes, certain cancers, congenital conditions, and viral infections, such as HIV, for example. Although the antiretroviral therapy has been proven very effective in the management of HIV and even beneficial to various cardiovascular factors, individuals living with HIV and adhering to antiretroviral therapy live much longer, and due to that, develop hypertension and cardiovascular disease. This slide is very complex, and you need not understand all of this, but in the setting of HIV, individuals can develop renal disease, endothelial dysfunction, similar to erectile dysfunction, and changes in immune responses, which all contribute to the development of hypertension. And of course, what would be a presentation without any COVID-19? So I'm sure many of you are aware of the desperate search in a vaccine, or at least some medication to alleviate the terrible symptoms of the severe acute respiratory syndrome coronavirus type 2. But there were also many arguments in the news that people living with hypertension should not use their treatment anymore, as it can worsen the effects of the SARS-CoV-2, which is actually not the case. But what do we know at this point in South Africa? So the SARS-CoV-2 contributes to the development of COVID-19, the manifestation of the disease. And in South Africa, we currently have this almost 84,000 confirmed cases with an active number of 37,000. But people with HIV in South Africa, especially the Western Cape, are 2.5 times more likely to die of COVID-19 than others. Men are 40% more likely to die of COVID-19 than women in South Africa, and people with controlled diabetes have 4 times greater risk of death compared to people with diabetes. People with active tuberculosis are over 2.5 times more likely to die of COVID-19 than people without TB. So this is indicating that in the setting of an additional immunodeficiency or immune response, that there is an increased risk of death, especially in the setting of COVID-19. Associations such as the American Heart Association, the International Society of Hypertension, as well as the European Medicines Agencies have reported that the use of an angiotensin converting enzyme inhibitors, which is a class of antihypertensive treatment, as well as the angiotensin receptor blockers, are safe to use during this COVID-19 pandemic in hypertensive patients. So this is to clarify all these question marks that were there initially about hypertensive individuals at higher risk of dying of COVID-19 and whether their treatment is safe to use or not, which is the case. So this is my story, and I hope you have learned something in this presentation, and to keep healthy and try to tackle developing hypertension. Thank you.
Prof. Ruwen, thank you very much for such a wonderful presentation. Without further ado, I'd like to introduce you to Prof. Martin Palamuleni. He is a professor within Population Studies and Demographic in the Faculty of Humanities. His research interests are demographic transition, demographic analysis, and reproductive health, amongst others. His presentation is titled A Demographic Perspective of Men's Health. Prof, welcome. The floor is yours.
The title of my presentation is A Demographer's Perspective on Men's Health. Men's health is defined as the holistic management of health conditions and skills and risks that are most common or specific to men in order to promote physical, emotional, and social health. These conditions include, among others, sexual and reproductive health, physical health, and mental health. Demographers are interested in population size, structure, and how these change as a result of fertility, mortality, and migration. But when demographers are talking about fertility births, usually they spend more time talking about female fertility, women having children. Male fertility is seldomly discussed. In addition, male fertility has long been neglected in demographic research. As we celebrate Father's Day, it would be nice to think about male fertility, as infertility affects men's health. The focus of female fertility is explained by a number of factors, including lack of data, quality problems with male fertility data, and the fact that the reproductive age range is less clearly defined for males than for females. In females, we safely assume that age range 15 to 49 is the childbearing age range. It starts with menarche and it ends with menopause. I'm mentioning it here because the absence of male fertility, infertility in particular, leads to a number of challenges such as stress and depression. And these challenges may result into mental problems among men. One way of measuring fertility is by calculating what we call mean parities, the average number of children ever born. And I did calculate this for South Africa using 2016 South African Demographic and Health Survey. The red line represents mean parities for women, whereas the blue one line represents mean parities for men by 5-year age group. And one thing that comes out clearly is at each age group, more women than men report higher number of children ever born. And at the end of childbearing, say age group 15 to 49, mean parity for females was 3, whereas the mean parity for males was 2.62. To me, this suggests that female fertility is slightly higher than male fertility. WHO, World Health Organization, describes infertility as a disease of the reproductive system defined by the failure to achieve pregnancy after 12 months or more of regular and protected intercourse. One way of measuring infertility is by looking at percentage of men and women with 0 children ever born. And I also calculated this from 2016 South African Demographic and Health Survey. You'll notice that at all the ages, at each and every age group, there are more men than women without children. The percentage of men and women without children at the end of the reproductive age range, say 45 to 49, is usually taken as a measure of infertility. And what my graph is indicating is at age 45 to 49, nearly 6% of women reported not having given birth to a live birth, whereas for men it was 14%. Probably one can claim that there are more men than women who are infertile. I took this graph from a report by WHO, World Health Organization. Basically, I just wanted to indicate that infertility is a global challenge. It occurs in all societies. However, from my graph, you actually see that the prevalence is much higher in developing countries than in developed countries. This is due to a number of factors, including poor access to reproductive health services. In South Africa, infertility occurs in, say, 15 to 20% of the population. Nearly 1 in every 6 couples are infertile. And some have argued that infertility affects both males and females, almost equally. The causes of infertility are many, and they include things like increasing age. Infertility increases as age rises. Obesity may result in infertility. Smoking, exposure to radiation, nutrition, taking supplements and steroids, and infections, particularly sexually transmitted infections. As indicated earlier, infertility results in stigma and discrimination. Friends and family, they may shun away from morbidity and mortality, morbidity, deaths, mortality, deaths, morbidity, illnesses. We assume you fall sick first before you die. We assume. In demography, we make so many assumptions. There used to be an old and outdated phrase referring to women as a weaker sex. But in demography, we have always known that men are the weaker sex and not women. Why? Women live longer than men, and men are less healthy than women. What I did was to get some numbers, statistics. In this particular case, I got something on expectation of life at birth, life expectancy at birth, the average number of years a person is expected to live if he is exposed to given age-specific death rates, mortality pattern. The only thing I wanted to illustrate here is that statement I made that women live longer than men. In 1996, for example, you find that life expectancy at birth was 61 for women, and 52 for men, a difference of about 9 years. I also looked at data from UN, United Nations, from 1950 to 2100. And what I noticed that throughout the period, life expectancy at birth is higher for women than men. And looking at the graph closely, you will find that in the 50s, the difference between life expectancy for men and women was about 4 years, but by around this time it has increased to something like 6 years. I also looked at age-specific mortality rates, and basically what I wanted to say here is the female superiority in terms of mortality is observed at almost all age groups, but it's more pronounced in the 25 to 65 age range. And at age 25, you basically find that the female superiority is nearly 3 times. Now, in demography, we also believe, and there's some evidence to an extent, that when you look at the age range 25 to 50, most causes of death in that age range are largely due to external factors. And when we're saying external factors, 90% are work-related deaths, particularly in men, maybe accidents, so transport accidents, and self-harm, suicide. Why are men less healthy? 50% of morbidity and mortality are due to behavioral factors. That's one other thing that we in population, in demography, talk about. Men are more likely to engage in risky behaviors than women, and these risky behaviors increase the risk of disease, injury, and death. That's why women live longer. Men's earlier mortality and higher rates of illnesses are due in part also to less healthy lifestyles. And why do men engage in risky behaviors? Men engage in risky behaviors overall due to this notion of manhood, being a man, being cool, the issue of masculinity. And some of the risky behaviors men are engaged in are, among others, more men than women are engaged in physical fights, in unsafe sex. More men than women drink. More men than women do not admit that they are sick, and they are less willing to discuss their health problems with a doctor, or to go to a doctor for assistance. These are risky behavior that are partly attributed to high mortality among men. Masculinity has also been identified as a key factor leading both men and boys and men to taking risky behaviors. And this notion of masculinity, it varies, it's cultural, it varies from one ethnic group, socioeconomic and geographic locations, and it also varies during the course of man's life. Men are more likely to be both perpetrators and victims of violence. And the exposure of violence during formative years, particularly in men, contribute to a range of challenges, and some of these are health related. For example, drug use, depression, challenges in relationships, homelessness, and as such, these perpetuate a cycle of violence in men's later lives. We in population studies, in demography, we also talk a lot about the 1994 International Conference on Population and Development. Why? Because this marked a major shift from just discussing mortality and fertility issues to health and sexuality. And it also saw the introduction of sexual and reproductive health rights. And these sexual and reproductive health were further reaffirmed at the ICPD Plus 25 that was held in Nairobi last year. And they came up with a statement accelerating the promise of reproductive health. And when we are talking about reproductive health, it's similar, I like it, it's similar to the definition of men's health that I indicated earlier. We are basically talking about complete physical, mental, and social well-being, not just the absence of diseases. And what I like also further, and that's the thing I put in mind, is that men and women should be able to enjoy a satisfying and safe sex life. Men are included in the definition of RH, although the emphasis has been on women health. What are the issues when we're talking about reproductive health? There are many, but they include things like contraception, family planning, safe motherhood, maternal health, infant and child health, sexually transmitted infections, including HIV/AIDS. They include gender-based violence, such as female genital mutilation. They include adolescent pregnancy, child marriages. They include abortion, infertility, cancer, and others. So that although the emphasis has been on women, but the men has a lot to contribute, to offer, as far as these issues are concerned. So that when we are talking, to me, when we are talking at issues like adolescent pregnancy or teenage pregnancy, there's too much emphasis on teenage mothers, less teenage fathers. More studies, more things, more work has been done on teenage mothers and not teenage fathers. We have done more work on contraception insofar family planning, knowledge use, women are concerned at the expense of, and not so much on men. As we are thinking of accelerating the promise, we must also consider men's contribution as far as some of these issues are concerned. Now, you basically find, I mentioned it earlier, I will not dwell much on it, the issue of masculinity, power dynamics, often skewed towards males, patriarchal society. I normally like watching Generation. There was a time talking about, and this, to me, this issue of power dynamics, talking about this issue of infertility. There was an actor there, Capella, and the Ketiwe. They were having problems of having a child. And Capella on the show was blaming the wife, Ketiwe. And Ketiwe, on the other hand, was saying, no, it's you, you are too old. Ketiwe went to church to seek for divine intervention. Capella went the traditional way to get some muti to give to Ketiwe, not to give, to administer that muti to himself. Another challenge that we also face as men is the issue of prostate cancer. Cancer of the prostate is now recognized as one of the most important medical challenges facing men. And prostate cancer is the second most commonly occurring cancer in men. There are also other types of cancers that are out there. Fortunately, it is said that prostate cancer is one of the most treatable cancers if identified early. But what is required is to sensitize and educate the population, especially men, on prostate cancer, and if possible, regular screening of men, particularly those 50 the above. In summary, all I'm trying to say here is men are at a higher risk of mortality than women at all ages, and there is need to educate men about how their bodies function and their special health needs, especially the link between lifestyle risks and diseases. Thank you very much for your attention.
Thank you so much, Prof. Martin, for your presentation. Our third and final speaker is Prof. Salome Kruger from the Faculty of Health Sciences. She is a registered dietitian. She is a pharmacist and a professor of nutrition in the Center of Excellence for Nutrition. Her topic is titled Healthy Eating for Optimal Health. Prof, the floor is yours. Welcome.
Today we will be talking about healthy eating and optimal health. And with this, I want to acknowledge the contribution made by fathers and men in general in families and communities. Also to share our research findings and knowledge on how to keep men healthy and strong. What I do not want to do today is to tell you not to eat any nice food like red meat and to eat salads only. This is not the goal of today's talk. All information shared will be based on scientific knowledge from peer-reviewed international publications. So today we will talk about obesity, which is a problem in South Africa, and also the risk of other diseases. Carbohydrates and weight loss. May we eat any starchy food? Weight loss quick fixes. We will touch on prostate cancer and nutrition. Also look at body composition in men and chronic medication side effects. Almost 1/3 of South African men are overweight or obese. They also have higher risk for type 2 diabetes, cardiovascular disease, and certain cancers. In this time of the COVID pandemic, in a Chinese study, it was found that obese patients are at risk of progressing to severe COVID-19, and more obese people had to go onto ventilators than people from normal weight. In Italy, they also found that obese people took longer to shed the virus. Therefore, quarantine in obese patients should be longer than in normal weight individuals. So what can men do to lose weight if they are already overweight? There are many different formulations on the market, teas, drinks, powders, capsules, but which of these are the best and are they effective? I looked at many different controlled research that was published, and one reviewed herbal medicines for weight loss in a systematic review, and they came to the conclusion that there's insufficient evidence to recommend any of these herbal medicines for weight loss. Another study looked at dietary supplements for obesity, and including most of those that I showed in the previous slide. And they also concluded that none of the supplements reviewed can be recommended for weight loss. One study looked particularly at the ketone capsules, the raspberry ketones that we find very popular nowadays. And they found that they did help to reduce hunger, but they have no effect on weight loss compared to a placebo. And also those who take the ketones reported mild nausea, but that's just part of the appetite reducing effect of these ketones. So what should men do? Because it seems there is no quick fix, no miracle formula, and no easy capsule just to pop or just keeping inactive. Let's have a look at diets. I found this on a website recently. That's the opinion of one expert on his own website. And he said, nobody needs carbohydrates. There is no recommended dietary allowance for carbohydrates. We can be like the Eskimos, not eat any starches, and we will still be healthy. And that's the only nutrient actually that we can cut out of the diet entirely. But when I looked at official websites, they told a different story. There is actually a recommended dietary allowance for carbohydrates, and that's 130 grams per day. And it's not that you should not exceed this amount. That's actually the minimum amount that must be in the diet every day for normal metabolism. So why are carbohydrate foods important? Because they are the best carrier of fiber in the diet. And this was a study where they compared patients with advanced colorectal cancer versus healthy controls, and they assessed the dietary fiber intake over the previous 5 years and also measured fecal cancer markers. And they found that the intestinal microbiome of healthy controls totally different from that of cancer patients, and those people with the highest fiber intakes had more beneficial bacteria, and that was found to be protective against colon cancer. In another study, they did an intervention in healthy people only, and they supplemented their diets with 60 grams of fiber a day, fiber-rich foods, and they found that fiber treatments increased microbial diversity, which is beneficial to health. And when they tested the blood, they also found lower inflammation markers and lower peak glucose in those people on the highest fiber intakes. So short-term whole grains altered gut microbiome and also improvement in physiological measures of inflammation and glucose control. So the advice then from the nutrition side is not to exclude carbohydrates from the diet, but select healthy carbohydrates, and that particularly fiber-rich foods like whole wheat bread and oats are very healthy dietary constituents. Further, refined starches, baked goods made from white flour and white bread should be kept to a minimum. Also sugars, sugar-containing foods and sugar-sweetened beverages should be restricted, and we should take more water and sugar-free drinks. So what about carbohydrates then in the weight loss diet? What did we learn from research? Here we look at a systematic review compiled by a group from Stellenbosch University, where they compared different diets for weight loss. And they looked at a low-carb diet with lower than 45% of energy from carbohydrates. That's just take note, it's not a banting diet, it's just a moderately restricted carbohydrate diet, and compared those with low-fat diets. And they found overall that actually the diet with carbohydrates restricted to 45% of energy led to better weight loss at the short term, 3 to 6 months. Another study, another systematic review where they pulled the results of 23 different studies, and the duration of interventions were up to 2 years. And they found that compared to a low-fat diet, the low-carb diet, patients actually had at a higher total cholesterol and LDL cholesterol, but they had also a better increase in good cholesterol, which is the HDL cholesterol, and lower serum triglycerides. So this is very beneficial, but similar weight loss. So people on the moderately restricted carbohydrate diet didn't lose more weight, but they had overall a better lipid profile. Once again, this is not a banting diet. So now we look at the banting diet. This was a systematic review of 13 different studies where they compared the very low-carb ketogenic diet with a low-fat diet for weight loss and also for metabolic markers. So they found with the ketogenic diet, there was better weight loss. But just note that the difference over the total period was slightly less than 1 kilogram. So it's not really a markedly better weight loss, but statistically it was significant. They also had lower triglycerides, lower blood pressure, and higher good cholesterol. That's all beneficial and all in favor of the ketogenic diet. Further, they had a higher LDL cholesterol, just as it was found in the previous study. But overall, this study showed in favor of the low-carb ketogenic diet for weight loss and for metabolic control. So let's discuss then why better weight loss with a very low-carb ketogenic diet. One reason could be that people who stay on these diets with a higher protein and fat content were able to maintain basal metabolic rate at a better level. So the energy expenditure just for metabolism was higher. Also, the ketogenic diet reduces insulin levels and helps to have greater satiety in the diet, so less hunger. So it was easier for these people to eat lower amounts of food and kilojoules in total. The higher bad cholesterol, LDL cholesterol with the ketogenic diets, that can be explained by the higher saturated fat intake. But overall, it is not such a big problem because the type of LDL cholesterol that forms on the ketogenic diet is actually a larger sized LDL cholesterol, which is less harmful to the blood vessels. So that's not really a primary cause for concern. Then the blood pressure effect, that's probably due to more monounsaturated fats in the ketogenic diet together with saturated fats. And that decreased blood pressure beyond what we can get with only salt restriction in the diet. So there seems to be many positive aspects to ketogenic diets, but they also reported that few patients could really adhere to this diet for a long time because it's very restricted. It cuts out many different kinds of food and it's also quite expensive. So what do we recommend for South African men? We know that in South Africa, the large majority of our population are in the low-income group. So even if they would like to follow a ketogenic diet, it won't be possible for them to just buy food like salmon and steak, biltong, almonds, other nuts. And they have diets based on staple foods. We have this problem of obesity in South Africa, also type 2 diabetes and hypertension, so they must follow a weight reduction diet, but the ketogenic diet cannot be followed by everybody. Also in the low-income group, who rely on staples, we must also remember that those staple foods, the maize and the breads, or white and brown bread, all of these are fortified with vitamins and minerals. And it makes an important contribution to the vitamin and mineral intake of men generally in South Africa. And it's appropriate because we still have many people with iron deficiency and several vitamin deficiencies. So we find that most men in South Africa have a dietary pattern habitually of starches, fruit and vegetables, protein foods, and some also include some legumes, which is animal or plant source of protein. And this food has many different benefits. So how can we then compile a good diet for weight loss from these foods? What we want men to do if they are overweight is just to move from this pattern where half of the plate is filled with starch, 1/3 with meat, and then just a small portion of vegetables, to move to a more balanced pattern with about 1/4 of the plate filled with starch, 1/4 with meats, and then half of the plate filled with vegetables or fruit. This is the South African food-based dietary guidelines, And each of these circles in this one-page pamphlet shows proportionately how much of this food group people must include in their diet for a good balanced diet. So we see the starches in the middle, and the recommendation, the South African guideline, is to make starchy food part of most meals. So add some starch in each meal, but select the healthy types, the high fiber type of starchy foods. Also include some dairy, so milk, mass, or yogurt. Some of this must be included every day, and try rather to use unsweetened yogurt, which could be high fat, if at all possible, but even sweetened yogurt is a very good source of calcium. Then some meat, eggs, cheese, fish, or chicken that should be eaten daily, and if possible with each meal. But if it's not affordable, it can be replaced by plant sources of protein, which are lentils, beans, peas, and soya. It can be made into a soup or eaten as a protein dish with starchy food. Then one will see that the circle for oils and fat is very small. So just enough butter or margarine, peanut butter, oil added in food preparation or with bread. In the circle for fruit and vegetables is a large circle again. So we want people to eat plenty of fruit and vegetables every day. Then another guideline to enjoy a variety, make up a mix. Ask a dietitian to help to compile a diet according to your own likes and dislikes. Be active, very important. And also, if you add sugar or any sugar-containing food, it must be small amounts and preferably part of a meal to have less bad effects on the teeth. Okay, so let's talk about diet and prostate cancer. And this is a real concern for many men because it is a genetic problem. So if it is in the family, there's a family history, then there's a higher risk of prostate cancer. The research showed that smoking and obesity are consistently linked with higher risk of prostate cancer. But we also know of some protective elements from the diet, including tomato, which could be raw or cooked, or even tomato sauce is a good source of lycopene, which is protected against prostate cancer. And then also the cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, they contain substances that are protective against colon cancer. Advice to men then, if there is prostate cancer in the family, if you are smoking, it would be a very good thing to stop smoking. Be physically active, maintain a healthy weight. And these lifestyle practices will also add benefits for total health and protect against diabetes and cardiovascular disease. Let's look at body composition of men, the fat, muscle, and bone. Sarcopenia is the inevitable loss of muscle mass with aging. So it happens in all men from around the age of late 40s, 50s, up to 60, 70. It's accelerating all the time. How to diagnose sarcopenia is with a DEXA scan or a bioelectrical impedance. It can be done with more precision, but if one doesn't have access to those diagnoses, then one can also do some physical tests of sarcopenia. Because a very low walk speed over a 6-meter course of lower than 0.8 meters per second is indicative of poor muscle function and sarcopenia. Also, in practice, we have this hand grip meter, and it's placed in the right hand or in the strongest hand, and then pulled to measure the hand grip strength. And if that's below 26 kilograms, It is also a sign of sarcopenia. One even worse condition is sarcopenic obesity. So that's where the muscle mass is low and the fat mass is too high. And the study showed that sarcopenic men have shorter survival from any type of cancer. Obese people have a better chance of survival or longer survival, but the sarcopenic obese, they had the poorest prognosis. So to have small muscle and big fat mass, that is really the worst case scenario. Why is it important? It's important because it affects quality of life and function, because it was found that sarcopenic obese men had a 2.6 higher odds of having difficulty climbing upstairs, and also a higher, more difficulty of going downstairs. And that's very often necessary to go to very nice places and can have an effect on quality of life. Here is a study showing the association between protein in the diet and muscle mass. It was done in men and women, but we see that the effect is more pronounced among men. So what they did, they measured the total amount of protein in the diet, and they divided the men into 4 groups according to the total protein intake per day. And they found that those men with the lowest protein intake at the start of the study also had the smallest amount of muscle mass in the body. And then stepwise there was an increase so that those men with the highest protein intakes also had the most muscle mass in the body. They followed them over 2 years, and then they measured muscle mass again, and they found that those men who had the lowest muscle mass also lost most muscle mass. So they ended with a very big loss of muscle mass only over a short period of 2 years. And then again it was stepwise, so that those men with the highest protein diet had the best retention of muscle mass for over 2 years. They also found that mealtime distribution of protein was associated with better muscle mass retention. And therefore it should be prescribed that men don't eat all their protein in just at the dinner meal or at the main meal. They must actually try to include some protein in each meal throughout the day. So the advice to prevent sarcopenia: higher protein intakes, focus on protein combinations. If protein foods are too expensive, include some plant protein, but eat protein foods with each meal. And remember that milk and yogurt and mass, they are also protein foods. Physical activity, very important, also including some resistance exercise like climbing upstairs, very good to retain muscle mass. And then in lifestyle, no smoking, because smoking causes more inflammation in the body, and that also leads to muscle as well as bone breakdown and fracture risk in men. Outdoor activity is very important for some sunlight exposure so that we can make vitamin D, because vitamin D is very important to maintain muscle mass and bone in the body. Then we will look at some chronic medication side effects. Unfortunately, we have very little time, so we will just focus on 2 different ones. The one is statins, and that's a drug that's very often used by older men for low blood cholesterol, very effective. But some people are somewhat worried about the side effects. But today I can tell you about a beneficial side effects of the statins. And it was found in a study in elderly men with low bone density as well as high cholesterol, that after 1 year of atorvastatin, that's atolip or Lipitor, after 1 year, they had very good reduction in total cholesterol as well as triglycerides. So that's beneficial change, and they had also increase in hip bone density and lower risk of hip fracture, which is also very beneficial. So that's good news for people using statins. Here are some results of another study showing that the bone resorption marker decreased significantly in people using statins compared to a control, and the bone density improved compared to the control where it decreased. Last, the proton pump inhibitors. That's a capsule that's very often taken by people with problems of heartburn or gastric ulcers, like Lancat. And they found that these proton pump inhibitors actually increase the risk of fractures. So it has an effect on bone health, and it works through an enzyme system in the bone tissue, and also by decreasing calcium absorption from the stomach due to reduction of acid in the stomach. Another side effect of the PPIs are that they are associated with lower blood magnesium levels. And that's particularly important in people with type 2 diabetes who are also using metformin, because metformin for high blood glucose also lower blood magnesium. And then the third type of drug that causes a low blood magnesium level are the diuretics that also causes magnesium excretion. So is it important? Yes, it is, because a low serum magnesium is associated with with the risk of sudden cardiac death, which is of course very, very important to prevent. So let's summarize. First, obesity, a real problem in South Africa. What can we do? Cut sugar from the diet, refined starches, include more fruit and vegetables. Carbohydrates can be included as long as they are whole grain, fiber rich. Those diet capsules and mixtures, little or no benefit, unfortunately. If you want to prevent prostate cancer, no smoking, weight loss, physical activity. If you want to prevent muscle loss and bone loss, exercise and protein foods with each meal, no smoking. Chronic medication side effects. Be careful with those PPIs for heartburn. Don't drink them year in and year out. Take a break sometimes so that, and also pay attention to serum magnesium level by eating a healthy diet or even using a supplement. And then last, what is a good balanced diet for a man? That is a plate containing half fruit and vegetables, 1/4 starch, and 1/4 meat with every meal. I thank you, and I also want to invite you, if you need any information about nutrition, ask a dietitian. Thank you.
Prof. Salome, thank you so much for your wonderful presentation on nutrition, healthy eating for optimal health. To all our three presenters, thank you for your preparations, for sharing the much needed knowledge amidst the COVID-19 epidemic, especially in a time when we're celebrating Father's Day. To the university management, thank you for providing us with such a platform, and to all various stakeholders within the universities which made this event possible. I would like to also extend my thanks. To the people who tuned in live, we would like to say Siyalebuga, Siyabonga, thank you very much, Bayadanki, and all the faculties and schools which took part in this program. Thank you very much. From me, Dr. Garuta, from the Faculty of Humanities, School of Social Sciences, Siyalebuga, Bayadanki, God bless.